Healthcare providers guide patients through diagnosis and manage their conditions for optimal health outcomes. Kindly subscribe to this channel for weekly health matters. This visual introduces the central concept of prediabetes, a condition characterized by high blood sugar. Prediabetes means blood sugar is higher than normal, but not yet high enough for type 2 diabetes diagnosis. Monitoring blood glucose is crucial for identifying and managing this condition effectively. The human pancreas is a vital organ located in the abdomen, behind the stomach. It plays a crucial role in both digestion and the regulation of blood sugar levels. Within the pancreas, specialized cells called islet cells produce hormones. One key hormone is insulin, essential for glucose uptake by cells from the bloodstream. Thus, the pancreas is directly responsible for maintaining proper blood sugar balance in the body. Insulin is a hormone produced by the pancreas, essential for regulating blood glucose levels. It acts as a key, unlocking cells to allow glucose to enter and be used for energy. Cell receptors on the surface of cells are the locks that insulin binds to. Insulin resistance occurs when cells in the body do not respond effectively to insulin. Despite insulin molecules attempting to bind, the cell receptors remain unresponsive. This prevents glucose from entering cells, leading to elevated blood sugar levels. Glucose molecules are essential for cellular energy, typically entering cells with insulin's help. Insulin resistance occurs when cells fail to respond effectively to insulin signals. This resistance impedes glucose uptake, causing glucose to accumulate in the bloodstream. The resulting excess glucose leads to elevated blood sugar levels, a hallmark of diabetes. A sedentary lifestyle involves prolonged periods of inactivity, often characterized by sitting. This lack of physical activity is a significant risk factor for various health issues. One major concern is its direct contribution to the development of prediabetes. Prediabetes is a condition where blood sugar levels are higher than normal, but not yet type 2 diabetes. Reducing sedentary time and increasing physical activity can mitigate this risk. Unhealthy dietary choices are a significant contributor to the development of prediabetes. Diets high in sugar, particularly from processed foods, can lead to insulin resistance. Excessive intake of high-fat foods also negatively impacts metabolic health. These dietary patterns disrupt the body's ability to regulate blood sugar effectively. Such poor nutrition increases the risk of progressing from prediabetes to type 2 diabetes. Prediabetes is a health condition where blood sugar levels are higher than normal, but not yet high enough for a type 2 diabetes diagnosis. Genetic predisposition plays a significant role in an individual's risk of developing prediabetes. Specific genetic markers have been identified that are associated with an increased susceptibility to the condition. These markers can influence how the body processes glucose and responds to insulin. The presence of these genetic factors indicates a hereditary aspect to prediabetes risk. Understanding these genetic links can help identify individuals at higher risk for early intervention. Obesity is characterized by an excessive accumulation of body fat, particularly adipose tissue. This adipose tissue can surround vital organs, impacting their normal function. Excess body fat contributes to metabolic dysfunction, disrupting the body's chemical processes. Therefore, obesity is a significant risk factor for various chronic diseases. Increased thirst, medically known as polydipsia, is a common physiological response. It often indicates the body's attempt to compensate for fluid loss or imbalance. One significant, yet often subtle, cause of persistent increased thirst is elevated blood sugar levels. High blood sugar leads to increased urination, causing dehydration and prompting the body to demand more fluids. Recognizing this symptom can be crucial for early detection of conditions like diabetes. Polyuria refers to the medical condition characterized by frequent urination. This symptom often indicates an underlying health issue, such as elevated blood glucose levels. When blood glucose is high, the kidneys work harder to filter out excess sugar. This process draws more water from the body, increasing urine production. Consequently, individuals experience an increased urge to urinate, leading to frequent restroom visits. Polyuria is a key indicator that warrants medical attention to assess blood sugar regulation. Uncontrolled blood sugar levels can lead to various health complications. One significant complication is the impact on visual acuity. Elevated glucose levels can damage the small blood vessels in the eyes. This damage can cause fluid to leak into the lens, leading to swelling. The swelling of the lens results in blurred or distorted vision. Maintaining stable blood sugar is crucial for preserving eye health and preventing visual impairment. Fatigue is a common, though non-specific, symptom associated with prediabetes. Individuals experiencing prediabetes often report feelings of tiredness and lethargy. This general feeling of fatigue can impact daily activities and overall well-being. The body's inefficient use of glucose can contribute to reduced energy levels. Recognizing persistent fatigue can be an early indicator for potential prediabetes. Acanthosis nigricans is a skin condition characterized by darkened, thickened patches. These patches commonly appear in body folds and creases, such as the neck or armpits. The skin in affected areas may also feel velvety to the touch. Acanthosis nigricans is often a visual indicator of underlying insulin resistance. Insulin resistance means the body's cells don't respond effectively to insulin. Regular physical activity is a cornerstone of primary disease prevention. Engaging in moderate exercise, such as brisk walking, improves overall health. This proactive approach helps reduce the risk of developing various chronic conditions. It strengthens the cardiovascular system, boosts immunity, and aids in weight management. Exercise is a fundamental strategy for maintaining well-being and preventing illness. A balanced meal plate is crucial for maintaining optimal health and preventing various diseases. Such a plate typically includes a portion of lean protein, essential for muscle repair and growth. It also incorporates whole grains, providing sustained energy and vital dietary fiber. Fresh vegetables are a key component, offering a rich source of vitamins, minerals, and antioxidants. Adopting these healthy eating habits is a fundamental strategy for disease prevention and overall well-being. Body mass index, BMI, is a widely used health indicator calculated from a person's weight and height. It categorizes individuals into weight ranges: underweight, normal weight, overweight, and obese. Maintaining a healthy BMI range is crucial for overall well-being and disease prevention. Deviations from this range, particularly overweight and obesity, increase risks of chronic diseases. These risks include heart disease, diabetes, and certain cancers, underscoring the importance of weight management. Stress management techniques are crucial for maintaining overall health and well-being. Practices such as mindfulness and meditation are effective methods for reducing stress levels. These techniques promote mental calm and physiological relaxation, counteracting stress responses. Reduced stress positively impacts various bodily functions, including metabolic regulation. Effective stress reduction supports better blood sugar control and contributes to improved health outcomes. Regular medical checkups are fundamental for maintaining optimal health and well-being. These routine examinations involve comprehensive assessments of an individual's physical and physiological status. A primary objective is the early detection of potential health issues or diseases before symptoms manifest. Screening tests and diagnostic procedures performed during checkups identify risk factors and abnormalities. Early detection facilitates timely intervention, often leading to more effective treatment outcomes and prognosis. Thus, regular checkups promote a proactive approach to healthcare, preventing severe health complications. Metformin is a medication commonly prescribed for managing prediabetes. It helps improve the body's sensitivity to insulin and reduces glucose production by the liver. This pharmaceutical intervention can help prevent or delay the progression to type 2 diabetes. Metformin is an important option within a broader strategy for prediabetes care. Lifestyle modification is a fundamental approach to managing various health conditions. Key strategies include dietary adjustments, focusing on balanced and nutritious food intake. Regular physical exercise is crucial, encompassing both aerobic and strength training activities. Achieving and maintaining a healthy weight is a primary objective of these modifications. These combined changes form the core management strategies for improved health outcomes. Medical information presented in educational content requires clear disclaimers. These disclaimers ensure ethical presentation and responsible sharing of health-related topics. A standard disclaimer states that the content is for educational purposes only. It explicitly advises viewers not to use the information as a substitute for professional medical advice. Viewers are urged to consult a qualified healthcare professional for any medical concerns. This practice protects both content creators and consumers from potential misuse of information. Professional medical guidance is crucial for effective healthcare and patient well-being. Doctor-patient consultations provide a platform for personalized medical assessment and advice. These interactions ensure that treatment plans are tailored to individual health needs and conditions. Such personalized care is fundamental for accurate diagnoses and optimal health outcomes. Subscribe for weekly health insights that could save your life. The subscription offers weekly health insights to the audience. The message emphasizes the potential life-saving value of these insights.